All right, so here's a question. Are there enough votes? Joining us now for a fair and balanced debate is Republican Congressman Aaron Schock of Illinois, a member of the Oversight and Government Reform Committee, and Democratic Congressman Eliot Engel of New York, a member of the Energy and Commerce Health Subcommittee. Thank you, gentlemen, for coming out and talking to us in the middle of a very exciting day on the House floor. Congressman Engel, let me ask you first. The House has formally begun debate on the health care reform bill, we understand. There's going to be 4 hours of general debate, as Wendell Goldler was just discussing, which that'll last until about 5 or 5:30. Then 20 minutes of debate on the Stupak amendment. I want to talk about that first. That amendment was added last night during the Rules Committee meeting, and it permanently bars federal money from being used for abortion. Now, I need to point out that there are more than 190 members of the pro-choice caucus. Congressman Engel, I want to ask you, is it likely that pro-choice women could actually vote against this rule?
Well, it's not a rule. From what I understand, that will come out in the form of an amendment. So, yes, I think many pro-choice people will vote against the amendment, but it's not in the rule itself. It'll be a special amendment, which will probably pass. But right now, both sides are scurrying around for votes. But the decision was made to put that language in a separate amendment rather than in the rule.
All right, let's talk about this health care reform bill passing. Congressman Schock, Democratic leaders have acknowledged that right now they don't really have the votes locked down needed to pass it. What will help to pass it?
Well, obviously they need the votes. Despite the primetime addresses the president has made, despite going on 5 of the 6 network television stations, despite all of the pressure and all of the public push, and despite a 70-plus seat majority in the House, Speaker Pelosi and the president have struggled to get the votes. And there's only one reason why the strength of the bill is not enough to pass it, and that's because the American people don't support the bill. And so I think that's why you see this weekend push is going to go late into the night. And ultimately, if they do get the votes, it will not be on the strength of the bill or the argument or the content of the bill, or because it's what the American people want, but more that arms get twisted and who knows what kind of promises and treats are given away in exchange for a vote. All
right, Congressman Engel, I see you there. I assume that you don't agree with Congressman Schock's assessment that arms are being twisted. However, the president has made a lot of appearances. Even this afternoon, he managed to come out on a Saturday to once again push his health care reform, and he was very quick to turn away from the microphones as soon as he was done. He was not about to answer any questions by reporters. Do you think the president's speech this afternoon will make any difference?
Well, it's not unusual for a president to come to Capitol Hill to urge members of his own party to support a bill. I've been here 21 years, and both President Bush's did it, President Clinton did it, now President Obama's doing it. I think when all is said and done, the votes will be there for health care reform. I think that compromise with the Stupak amendment was the final touch, and I expect that by the time this bill was voted on later today, it'll have 225 or maybe even 230 votes. I think when the American people understand what the bill really does, there's been so many misperceptions and distortions from the other side. I think everyone will agree that we need affordable quality health care reform, and this bill does it, and this bill will be a great help to health care in this country, not a detriment at all.
All right, it's amazing you two can stand next to each other yet disagree so strongly. When he's talking about these misperceptions from the other side, Congressman Schock, that's you. I mean, let's talk about where the numbers are now. Now, even if the House Dems are able to muster the 218 votes for a bill today, which is no small victory, there is still a long way to go. How tight are the numbers?
Well, I certainly don't know. I mean, obviously, the Democratic leadership and the whips on their side are keeping that information very close to the vest. Here's what we know. If the majority would have had the votes in July, they would have passed it before the August break. If Speaker Pelosi would have had the bills after the Labor Day holiday, she'd have called for a vote and passed it. If they had the votes earlier this week, they would have called a vote and passed it. If they had the votes yesterday, like she said there was going to be a vote a week ago, they would have passed it yesterday. There's a reason why the president's over at the Capitol now. There's a reason why members are being called in one by one to put pressure on them. To your point, though, about misperceptions or what have you, the one theme that continues to be talked about is the need for insurance reform, the need to try and bring down costs to ordinary American citizens. And I think the most important point that people need to understand is that among all the other things in this bill that's going to be voted on, over half of the new folks that are going to be covered by some kind of program are done so through entitlement programs, not through lowering premiums for private insurance, but rather expanding them into Medicaid and other forms of government-run health care. And so what you're doing really is exacerbating those in the private health care market because of cost shifting, because more and more of those costs have to be borne by those of us who have private health insurance. So it's really disingenuous from the standpoint that when we talk about insurance reform and bringing down costs to individuals, this bill is really going to make it worse.
Congressman Engel, you're shaking your head?
No, I think that's not correct. The American public knows right now that their premiums have been skyrocketing year after year after year. The health insurance companies love it the way it is because in many states, there's no competition. There's just one insurance company or maybe two to insure you. And they like the idea of being able to collude amongst themselves and keep prices high. We believe that this bill will lead to a lowering of premiums, that people will have to pay less for health care. And what's more important, people cannot be denied health coverage because of a pre-existing condition. And if people change their jobs or lose their jobs, they will not lose their health care, as is the system today. So we think that this improves the system. It gives more people health care, and it makes sure that health care premiums are kept low. We also know that many people are about to lose their coverage. This has been happening because people can't afford coverage or employers drop people, and this bill will stem that tide and make sure that the American people have the coverage they deserve.
All right, and we will cover the bill, whether it gets voted on or not, yay or nay, find out around 8 to 8:30, I understand, sometime, 8:30 p.m. Eastern Time. We will have it here on the Fox News Channel for you live. Thank you so much, Congressman Engel and Congressman Schock. We appreciate you both for coming on today. Fair and balanced.
Good to be with you.
Good luck.